Welcome to Florida's COVID-19 response, a presentation by Caitlin Cox, Mustafa Gattelrob, Brenna McCaffrey, and Jalen Williams. Our mission is to promote the prevention and spread of COVID-19 in Florida among populations identified with consistent rates of new infection and case facilities by collaborating with community agencies and local institutions to build on existing networks through creative and innovative means that provide the population with accurate pandemic health information and responses. Our public health plans aim to account for the diversity of Florida's population and to craft communication that appeals to the common good of Floridians to stop the spread of COVID-19. As of November 13th, 2020, Florida has amassed 875,088 COVID-19 cases, with 17,488 cases resulting in death. With a population of 21.5 million and a case rate of 4,074 per 100,000 residents, Florida continues to have the third highest number of COVID-19 cases in the United States. The top counties infected with COVID cases account for 40% of Florida's total cases. These three counties include Miami-Dade, Broward, and Palm Beach. All three are the largest populations in the state of Florida, and their total cases reflect this. However, it is important to note that although Palm Beach County has the third largest number of COVID-19 cases, it has the second highest death rate. Governor Ron DeSantis has led the pandemic response, but it has starkly contrasted with other states similar in population and infection rate. Florida Department of Health issued guidelines, implemented a COVID-19 hotline, and declared a state of emergency 4 weeks after their first case was identified in the first week of March. A statewide stay-at-home order was issued on April 1st, but was lifted 3 weeks later when Governor DeSantis declared that Florida had flattened the curve. We would later see that had not flattened the curve, because on July 12th, the state had its highest number of daily reported cases of 15,300 reported in a single day, which surpassed New York's total infection rate on July 27th. Since October 6th, Florida's cases have begun to steadily rise every day. The state government has implemented no new measures to stop the spread since its case rate has begun to increase. Surgeon General Scott Rivkees has not participated in public COVID-19 briefings since mid-April. His absence is attributed to a deviation from messaging approved by Governor DeSantis. A Florida COVID-19 task force was never created. Due to Florida having 16% to 18% of all new COVID-19 infections between the ages of 15 years old, 54 years old, and the median age of infection daily can range from 37 years old to 40 years old, social media will reach a very wide range in age demographic. Current data providing racial and ethnic data provides infection rates for white, black, other race, unknown race for racial identities, and Hispanic, non-Hispanic, and unknown for ethnic identities. Ages ranging from 75 years old to 84 years old and 85 plus accounting have a 13.2% and 26% case vitality rate, but only account for 4% and 2% of the new COVID-19 cases in the state of Florida. By collaborating with Florida's health department via social media, accurate public health information can be spread on to prevent the spread of COVID-19, when to seek medical treatment, and COVID-19 testing sites, assisting willing businesses in creating safeguards to protect and prevent COVID-19, like providing sanitizing stations spread throughout businesses for consumer access, PPE, availability to staff, and consumers by choice, and provide business owners with posters to hang with appreciate COVID-19 prevention and safety measures. These are just possible outcomes that could be produced from this collaboration. Foster relationships to collaborate with nursing homes for the elderly, community centers, and non-provides that provide outreach and services to the elderly population to provide educational materials, PPE, and insight on safeguards to prevent the spread of COVID-19. Although limited visitation and mobilization may have been implemented relatively early, closer monitoring regulation can have a more significant impact. Perhaps these tasks can be undertaken by state or city employees from the state of Florida. Monitoring places like nursing homes and assisted living facilities is key to reducing unnecessary deaths and hospitalizations among Florida's population. Collaboration among pharmaceutical companies in the state to expedite best possible diagnostics, antibody tests, and performing clinical trials for possible vaccines is another necessary undertaking if the state of Florida can tackle COVID-19 in the most effective possible way. With more pharmacists, researchers, and scientists in general joining together to come up with faster, more accurate ways to diagnose and look for COVID-19, the more efficient the whole process will be. Streamlining the process will help the state tackle the COVID-19 crisis more effectively. Effective public health programs require accurate, timely information systems for disease or risk factor surveillance and program implementation. During a public health crisis like the COVID-19 pandemic, it is crucial to use the already existing infrastructure to ensure quick and accurate surveillance of public health response. We will use local, county, and state level lab, hospital, and clinic reporting for positive test results, hospitalizations, recoveries, and deaths to accurately capture data trends. Performance management also includes ensuring we are adequately using the labor power and resources we have available to us and not wasting too much time or resources on hiring or training new workers. We will redeploy non-essential county and state employees, such as social workers, case managers, and others, to manage the implementation of shutdowns, minimize movement, and restricted visits at crucial sites. These employees can also help implement surveillance of these sites by collecting information about the policies of private facilities and tracking any outbreaks at the crucial sites. We will also need to monitor public response to our communication and messaging plan. To do so, we will utilize social science researchers to conduct surveys of samples of the population about whether the Florida Department of Health messages have reached them. These surveys can also help us assess Florida residents' willingness to comply with state mandates like wearing masks, staying at home, and recommending testing, which can inform future decision-making for long-term innovation and technical package. Coalitions are often essential to progress. Frieden emphasizes that in many of the components necessary for effective public health program implementation, forming partnerships as well as strengthening already existing partnerships are key. Our efforts have been focused on ensuring the public health messages are being sent to and received by the correct audiences. To do this effectively requires cooperation across many sectors, both public and private. It begins with federal, state, and local municipalities. Constructive cooperation can often be hindered at these levels due to bureaucracy and budget processes. We have seen this kind of collaboration before. In 2015, the state of Florida committed to reducing tobacco use among student populations. Through training of several participants across the state, we see tobacco use drop steadily among students in high school, with the percent of students having reported trying cigarettes go from 22.9% in 2015 to 17.2% in 2018, a reduction of 5.7%. Additionally, the percent of students who reportedly tried hookah in 2015 was 21.2%, and by 2018 that number was 15.5%, a decrease of 5.7% as well. This was a result of a statewide effort where the Department of Health trained and employed local community participants to attempt to reduce tobacco use in middle and high school students. Social media can provide room for engagement via social media post, comment, and video response. That can allow us to directly reach a broad age demographic who have various social media communities. We can curate content and responses that align with our mission statement and core values. Social media presence can portray the work we do to media outlets through our narratives, posts, and responses. Our stories and articles will give us a credible presence in the media that will provide traction and credibility to political, community, and local stakeholders. Political commitment is one of the most integral components of our mission and media campaign. We will seek to advance our objectives by soliciting advocacy from local and state politicians in Florida's most impacted areas. Soliciting legislators who represent the districts in Florida's most impacted and most densely populated counties. These counties include Miami-Dade, Broward, Pinellas, Hillsborough, Palm Beach, and Orange County. We will focus on politicians with strong household name ID, such as Debbie Wasserman Schultz of Broward County and Val Demings of Orlando. We will also seek commitment from Senator Marco Rubio and Rick Scott, as well as Governor DeSantis. We will leverage pre-existing special interest group partnerships with local government politicians. Special interest groups chosen will be stakeholders in the positive results of our mission. These special interest groups will include the New Florida Majority Education Fund, Florida Medical Association Political Action Committee, and the Democratic Progressive Caucus of Florida. We will leverage Democratic Progressive Caucus of Florida to understand possible opposition so that we can have a predisposed plan to combat opposition. We will engage the politically disenfranchised across all of Florida. We'll do this by having an awareness campaign aimed at helping disenfranchised Floridians understand the impacts of COVID-19, partnerships in television, media, and social media to launch our messaging and ensure its reach is effective. We will also utilize the new Florida Majority Education Fund to understand Florida's disenfranchised populations. Thank you.